Dr. A.C. Mandal, a physician who devoted himself to relieving back pain with natural spinal posture, said of the great difference between sitting in a saddle and sitting on a conventional chair, without doubt, the best posture for sitting is achieved on horseback. The hip joints bend by 45 degrees in a resting position. The anatomical S-shaped curve of the lumbar vertebra is thus retained, which is not possible when sitting on a flat seat. So the load within the intervertebral discs is barely 100 kilograms in an erect standing position. When you're sitting on a straight chair, it is already 140 kilograms, and if you're leaning forward while sitting, the intervertebral disc load increases to up to 175 kilograms. When you're sitting in a saddle, the load on the intervertebral disc is no greater than when you're standing. Here, the two critical aspects are again made clear. If the hip joints cannot achieve their anatomical resting position of about 45 degrees, the lumbar spine is exposed to a static curvature. Only the rider position allows the hip joints to bend about 45 degrees, which results in the spinal column being supported in its natural posture. Designing a sitting device that allows a similar sitting position to that achieved on horseback was therefore really a logical consequence of this realization. And that's exactly what Australian occupational therapist Mary Gale has done. In a team including physiotherapists, orthopedists and engineers, she developed the Bambach saddle seat. Even in a bent-forward posture, such as that required when treating patients, the physiological curve of the lumbar vertebra is maintained. The Bambach saddle seat is used also to prevent and eliminate posture-related back pain because it supports the natural position of the pelvis and spinal column during sitting. The height and especially the tilt angle of the seating area can be adjusted. That results in the pelvis being upright even when you're leaning forward, which is unavoidable for dentists.